Hi, this is Chris with Yoko CO. I'm really excited to share the site that we built with Healthcare Without Harm with you today. Healthcare Without Harm, if you're not familiar, is a global organization working in all of the populated continents and really waging a war to build a better world on a number of different fronts. The site is really multifaceted and has a lot of components that come into play. There are resources in many different languages. The full site is available in English as well as Spanish and Portuguese. There are regional components. What I'm going to walk you through today is the U.S. portion of the site, but there are regional pieces that are showcasing Latin America, Asia, Europe, and then kind of the world as a whole, and some of the areas that they may not have as much of a presence in to dedicate simply to Russia or India or whatever the case might be, but covers all of those areas inclusively. So what we're going to do is we're going to jump into the US and Canada and use it as kind of a showcase. As a nonprofit, one of the most important elements is, of course, to be able to drive donations, both large and small. That's how they thrive. The other, one of the primary components that came up was because they do so much on so many different levels. And, this is one of the things that really spoke to me and a lot of us over here at Yoko CO is the number of issues that they take on. I don't know how they manage it, to be quite honest. They do a whole lot with, in some cases, not very much in terms of resources. But some of the things that are really, impactful and stood out to us is healthy food and healthcare, and understanding the role that nourishment plays in rehabilitative care and getting people out of the hospital so they're not exposed to other pathogens. Toxic materials, you'd be surprised how many are in products or are being dumped and discarded in areas where they shouldn't be, and governments aren't really doing what they need to do to regulate that. And one that was really kind of near and dear to my heart is clean energy and understanding just the vast amount of energy that the healthcare system requires. And there's a lot of areas where by using renewable resources, we could reduce a lot of the pollution that is a direct derivative of that energy demand. Yeah, and that's what I want to do is I want to kind of showcase a little bit more of the site for you. As I said, structuring the site so that it was easy for people to figure out what issues and programs Healthcare Without Harm was actively working on. And the other component is, as you can kind of see, we've got the content for each of the different regions here across the top. By jumping into any of these, you can see what's going on in that region as well. And then another component that we built in is the ability to cross-pollinate between regions. Which is something I think is really, really important because, especially these days, I think this is reinforced by social media. We're in our own echo chambers or filter bubbles, and we don't always see what's going on outside of our own region or our own, social circle. And what we were able to do with Healthcare Without Harm was not only showcase, hey, here's what's going on in your region, your country, whatever the case might be, but also here's what's going on abroad and what you need to be aware of. So there's some cross-pollination between each of the different regional sites here. And from a kind of internal human resources and political structure in terms of the organization itself, there was kind of a fine line because each of these regional directors is essentially operating its own nonprofit in each of these areas. And so we need to make sure that we could build a site that gave them all the freedom to basically run a site on their own while still being able to cross-pollinate, share information, and make use of resources, as well as tap into those economies of scale that take place rather than each of them trying to build a site in their own region with their own resources. And so that was a big component of what came into play here. And then finally, there's also some other components here because they are a global organization. They're connecting with not only folks in areas where there may be fast internet, like here in the States and of course many of our other first world countries abroad, but they're also connecting with people in third world countries. And for that reason, we also provide a text-only version of the site so that it's able to load more quickly, people are able to interact, and better reach out and contact and communicate with the folks over at Healthcare Without Harm. I could go into a whole lot more with this site. I definitely suggest you jump in and check it out. It is a treasure trove of not only content and information, but stuff that might really open your eyes. They also do a really good job in communicating through their newsletter. So if you do check it out, I suggest you go ahead and just subscribe, take a look at some of the things that are going on. Again, I think it'll really open your eyes. Just a real privilege to be able to work with these guys. If you've got any questions about their site or yours, please feel free to contact us. You can find us over at yokoco.com. That's YOKOCO.com. Thank you. Take care.